Purpose of assessment. The Minnesota Manual Dexterity is a standardized test for evaluation of a subject's ability to move small objects in various distances. It is used to measure a subject's simple but rapid eye-hand coordination, as well as arm-hand dexterity. It considers 3 classifications of motor skills: precision of movement, defining the beginning and end points of movement, and stability of the environment. PTs and OTs use MMDT mainly for injury rehabilitation because it collects baseline data of the patient and documents patient's progress and/or degree of disability. Client factors and performance skills assessed.
When looking at client factors while assessing skills throughout the Minnesota Manual Dexterity Test, we are looking at visual function by checking to see how fast the body is able to plan movement in response to visual stimuli. Throughout this exam, we are also checking control of voluntary movement by examining subject's dexterity response, specifically assessing how well subject is able to switch from one task to another and manipulate objects. This test is also addressing motor control by assessing the coordination of joints and muscles in the upper extremity.
Population and settings used for.
The Minnesota Manual Dexterity Test may be administered in occupational and physical therapy settings. Occupational therapists can use the Minnesota Manual Dexterity Test to determine baseline skills and document degree of disability and progress for a wide range of individuals, including those recovering from injury in the upper extremity and this test could be appropriate to administer in skilled nursing, inpatient rehabilitation, and home health settings. This test may also be used in vocational evaluation or employment screenings to test subjects' aptitude for tasks involving manual dexterity. Furthermore, the Minnesota Manual Dexterity Test may be administered on adults in rehabilitation and with the elderly population.
Cost and source.
Many rehab therapy sites, such as Lafayette Instruments, produce the MMTD. Cost can vary from $290 to $400.
Supplies needed. The Lafayette, Minnesota Manual Dexterity Test that includes an instruction manual, test board, 60 black and red plastic discs, a score sheet, a timer or a stopwatch, and a test table between 28 to 32 inches in height. Preparation of test. Method of administration procedure.
I'll be talking about the Minnesota Dexterity Test, and there's a couple of things that you need to know before administering the test to your patient. First thing is to make sure you have a stopwatch or a wall clock in the room so you can record the time needed from the assessment. Another thing is that you need to give the patient a practice trial after explaining the 2 tests to them so they can practice before taking the 4 trials that are needed to calculate the scores that are needed for the baseline assessment. Another thing to keep in mind is if you are able to do a group testing with the patient, with a bunch of other patients, because this encourages motivation, it encourages competition, so it encourages the patient to try and finish the test at a faster time. The first subtest of the Minnesota Dexterity Test is going to be the placing test. So what you're going to have the patient do is you're going to set up the board as so, according to this image here in the manual. For each of the 2 subtests that you will be administering, what you will do is read the script that's provided for you in the manual here. And what this script is basically a step-by-step of the instructions that the patient will need to do. So once you explain the steps to them, you're going to demonstrate the test yourself so they can have like a visual demonstration as well. After you do so, you click the timer and hit go and tell the patient go. They perform the test, and once they're done, then you hit stop. So same thing goes for the turning test. You demonstrate the test to them after you give them the instructions, and the instructions are here in this little script as well. So read them the script, then demonstrate the instructions, which are going to be very different. So the turning test instructions are going to be very different from the placing test one. So that's important to keep in mind. Read the instructions that are here, give the test, and then again, hit go when you want them to start, and then hit stop. Then you're going to record whatever scores there are into a score sheet that's provided with you. So now that we talked about how to administer the test and how to perform the test to the patient, we're going to talk about the score sheet that's used to collect the data. So first, of course, you're going to put your name on the test, the name of the OT. You're going to talk about whether the patient is right hand or left hand dominant throughout the test. And you're going to talk about the reason for administering the test. So it's important to understand that with this test, it's used to determine bilateral and unilateral gross and fine motor skills along with hand-eye coordination. So you could put down one of those reasons. You can talk about why you're doing this. Maybe they need to play a sport, or whether they want to draw something and they need to determine whether they have the skills for it. So you would put down your reasoning right here. And then you would put down whether it was a group or an individual assessment. And then here, let me turn it on its side so it's easier to see. You have the score grid where you're going to put the scores for both tests. So it has your placing test score and then turning test score. You put the time for the practice trial. That's important to keep in mind. Please record the time that it took them to finish the practice trial. And then you have a grid for each one of the 4 trials you will be doing. So once you have all of those together, then you're going to score both score A and score B, and we will go into more details about how to score those.
Test procedure. Placing test. Dominant hand.
Okay, so we're going to be testing your eye-hand coordination. We're going to be using this test right here. So what I'm going to have you do is to just pick up these discs and put it in to the hole. And then you'll just pick up the next disc and then just do it and so on. We're going to start by using your dominant hand. Which one is your dominant hand?
Right.
Your right hand? Okay, perfect. And then with you doing that, I'm going to time you, so do it as fast as you can, okay? Ready, and go.
Non-dominant hand.
With your dominant hand, we're going to test your left hand now. So the same thing you're going to do. I'm just going to be placing the disc again into the holes, and then I'm putting it in the same column as well. Okay. Ready? And oh my gosh.
Turning test.
So we're going to be doing the turning part of the dexterity test. So what I'm going to have you do with your left hand, pick up the block and then give it to your right hand and then put it back on the opposite side. And you're going to keep doing that for the rest of the row. And make sure you place it exactly on it. If you accidentally drop it, you're going to have to pick it back up and put it back on the right side up. And then once you get through this whole first row, now you're going to take your right hand and do the same thing, but with your right hand, pick it up, transfer it to your left hand, and put it back. And do that for the second row. And then third row, you're going to use your left hand again. And then for the fourth row, you're going to use your right hand again. Does that make any sense? Do you have any questions?
No, good.
Awesome. Are you ready?
Ready.
All right, go.
Scoring procedure.
Once you have collected your raw scores, meaning the time the patient took to complete each trial, you will then convert it into a scale score for analysis.
First, you must sum up the values of each test, and then you will use the chart provided in the manual to convert it into a scale score. This chart was created based off the scores from previous studies and is a collection and interpretation of that data. There are 4 types of interpretation scales that occupational therapists can use: percentile, standard, stannile, and verbal. For today's test, we chose percentile for the interpretation. Take that sum value of all 4 trials from the test and look for that value on the chart. To the left of it, you will see the percentile and the individual scored in for placing. Once you have done that, do the same for the turning test. We can see that the patient scored in the 31st percentile for placing and the 23rd percentile for turning. These scores provide a baseline for patient performance for the occupational therapist to create an appropriate intervention plan suited for their skill level.
Connection between assessment and occupation-based practice.
The Minnesota Manual Dexterity Test is used to determine upper extremity bilateral and unilateral coordination, as well as gross and fine motor skills. Occupational therapists can use this data to establish a baseline of client's ability to perform a wide range of occupations, from simple ADL such as brushing teeth to participating in active leisure, such as playing sports or painting. OTs can use this information to establish a beginning point or baseline for occupational therapy intervention to restore function in clients' desired occupations.